Hi, I'm going to review the breastfeeding journal with you guys and kind of talk about it like I would talk about it with a mom and what to expect. So currently we're introducing the journal when mom gets moved over to postpartum, but we're going to be changing that, and the journal is going to be introduced to mom during labor. At some point when the mom is comfortable, you feel like she can listen for a few minutes, it's a good educational resource for mom to learn. And also involve the dad or the significant other and show them how to document on the journal, because they'll help the mom out a lot during their stay here. So when you look on the inside of the journal, there's tips for mom. Moms and dads and significant others often worry that their baby's not getting enough because they really don't know what the baby's getting during a breastfeeding session. So this journal will provide reassurance to mom to know the normal goals and the normal amount of feedings, the normal amount of wet and poopy diapers a baby should have during each day of life. The journal will cover 2 weeks, so every box that's in here is a 24-hour period of time. It'll help show the baby's progression with breastfeeding. So for instance, the very first box, the first 24 hours of life, is the top box. What's expected is that the baby eats 4 to 8 times in the first 24 hours and has 1 wet and 1 poopy diaper in the first 24 hours. This box will show what the stool should look like. So for the first couple days of life, the stools should be black and tarry, and as the baby gets more breast milk, because mom's milk will come in around day 3 through 5, the stools will start transitioning. So by day 3, the stool should turn more greenish and more pasty. Definitely by day 4, the baby should be having more yellow stools with breastfeeding. So I usually tell the parents it's a red flag if you're looking at the amount of stools the baby's having on day 4 and the last time the baby had a stool was a day ago. So make sure you educate the mom on the progression. Every day the pees and the poops should go up. The first day of life, the baby should have at least 1 pee and 1 poop. Second day of life, 2 pees, 2 poops. Third day of life, 3 pees, 3 poops. So it goes up each day because the baby will be getting more milk. As far as the feedings go, the first day of life, babies are sleepy after the first feeding. So a lot of times they'll do well the first feeding, and then after that they get into a sleepy phase. You still have the mom try to wake the baby up at the 3-hour mark. Some of the times she won't be successful. Usually the baby will have a pretty good feeding every 3 to 5 hours, and that would come out to about 4 to 8 feedings in the first 24 hours. A healthy term baby can handle that. This journal is really meant for a baby that's a healthy term baby, not for like a preterm baby or for a baby that's struggling with other things. So that's what this book will do. It'll reassure the mom that the baby's doing okay, the baby's staying hydrated, the wet and poopy diapers are where they should be. The inside cover she can look at, and it'll talk about hand expression, and she can use hand expression for a feeding if the baby's sleepy. The second day of life, it'll talk about cluster feeding. The baby might eat every 1.5 to 3 hours. So there's some really good tips on the front cover. The instructions on how to record is on the second page. And again, this journal goes up to a couple weeks. Many parents wonder how long they have to wake up their baby at the 3-hour mark. I usually tell moms and dads, wake your baby up until breastfeeding is well established. Usually that's about 10 to 14 days after delivery. The baby's gaining weight well by then. Mom's milk is in nicely by then. And then at that point, after the baby's back up to his or her birth weight, the feedings become on demand. Also, please observe a feeding every shift. Thank you.